This is my journey. Inspired one story at a time, a library of leaders was created. It began as a journey to learn. As time went on, it began to grow. All it needed was a platform, and this podcast was created to listen, to inspire, to share. I am a storyteller, and this is my journey. Welcome to another episode of Profiles in Leadership. I'm your host, Steve Anderson, and today our guest is Dr. Julie Wilson, named one of Canada's top 100 most powerful women and a 40 under 40 award. She is nationally recognized physician, entrepreneur, and the founder and CEO of Terra Nova Medical Clinics, British Columbia's largest and fastest growing physician-led clinic network. While many clinics shut down during the pandemic, Julie leaned in, scaling Terra Nova from one location serving 25,000 patients to 7 thriving clinics that now care for over 50,000. She did it by building a culture where practitioners thrive, leadership is nurtured at every level, and operational excellence is fused with compassion. Terra Nova's impact has earned recognition like Best Workplace in Healthcare, Best Workplaces Managed by Women in 2024, Outstanding Workplace of the Year in 2022, and nominations for the Business Leadership Award, the Small BC Business Impact Award, and the People's Choice Award. Julie is still a full-time practicing doctor while mentoring international medical graduates, shaping healthcare policy, and challenging outdated systems with a modern model of connected, tech-forward, people-first care. She's redefining leadership in one of the toughest industries to scale and proving that purpose, profit, and people can all grow together. So, Julie, welcome to the program. It's great to have you on today.
Well, thanks for having me. What an introduction. But I have to say,
Well,
to
it's
see
all
that
you.
we
What's that?
actually now have 20 clinics instead of 7. So we now have,
Holy cow. Okay. Yeah, we did have this scheduled earlier and it didn't work out, so I'm a little behind on the stats. So thank you for updating us. 20, that's a big growth. So tell us a little bit, give us a little context to go off of. Were you born and raised in Canada? And just kind of tell us a little bit about that part of your life and then how you became interested in medicine.
oh, yeah. So yes, I was born and raised in Canada on the West Coast here in Vancouver. And I always wanted to be a doctor. I guess in Canada, it's really taught to us that it's part of our national identity that we have healthcare for all, that everybody is equal, and we all deserve the right to healthcare.
Yeah.
So, feeling that it felt like something I wanted to be part of. It felt like a very noble goal. And, as a child, here we have a primary care based system. So the only doctor I had ever seen, and most people had only ever seen, would have been a family doctor. So that's what I wanted to do when I grew up. And I did follow through with that, and that is what I did become.
Yeah, that's amazing. And so did you go to medical school in Canada as well?
Yeah, I did my undergraduate in biochemistry at UBC, University of British Columbia, and I did my medical school there as well. And I thought 8 years enough, let's try somewhere else. So I did my residency at U of T, University of Toronto.
Okay, great. Great. So tell us a little bit about, so you just said that you have 20 clinics now and the business hasn't been around for that long, so that's pretty rapid growth, especially in an industry that in the US as well as Canada is not an easy business to grow. So just tell us why you decided to have more than just one practicing clinic and treating patients and what's your vision and theory going forward.
Oh, yeah. I think it happened. I must be the only business growing so quickly accidentally. It really just blossomed. I had my own first clinic I started building in 2014 and it opened in 2015. And the climate in our medical system back then was maybe how you would have seen it in the US in the 80s, where every single doctor had their own office. And it was fine because it was cheap and easy to do so. Rent was cheap, wages were cheap, fax machine, paper and pen, and that was about it. And in that climate, you didn't have to be a good business person. You could just, as they say, put up your shingle and start practicing.
Yeah.
By the time I had gotten out of residency and wanted to start my own practice, it was a little bit different. It was more expensive, it was more difficult, but it wasn't impossible, and it was still a normal thing to do. The difference with me is that I wanted to be a little bit in the future. I didn't want to be on paper. I just thought it looked messy and was easy to have pieces of paper loss. And, I don't have to explain to a modern person why they wouldn't want to have a paper office. But
Right,
people
right.
thought that I was wasting time and money to try and have an electronic medical system. And I also wanted to take time off and have vacation. Our doctors, they usually just never took time off and never took vacation, never got sick. They just kept on working all the time. So I built a larger clinic. So instead of being a solo provider, we had 5 doctors working together, covering each other, taking vacation, using our economies of scale to get better equipment, better staff. And that was very lovely. I really enjoyed it. But the reason we started expanding was not because I imagined myself to be a business person, because technically I own a business, but we didn't think of it that way. We thought, I have a clinic, I don't have a business.
Okay.
Is that during the pandemic, when we were asked to switch to telemedicine, I just I couldn't bring myself to do it. Of course, I did telemedicine, but I couldn't bring myself to only do telemedicine. So I did the hardest thing I've ever done in my life, which is to keep us open 7 days a week in person. In order to do that, I had to learn concepts like company culture,
Yeah.
words like supply chain, these very basic things in other businesses, but we didn't really have. So in that environment, when all of the other clinics were closing and business clinics were going out of business, the walk-in clinics closed, nobody was seeing anybody in person. We were open 7 days a week the whole time, every day but Christmas. And to do that, luckily we were on lockdown. I didn't have much else to do. I had to read books, learn concepts, make changes, and then just do one iteration after another. And probably 1 million iterations in, we actually became a decent business.
Yeah, that's impressive. So tell us a little too about, not all my listeners are US based, but a lot are. So, we understand that Canada for a long time has had more of a universal healthcare system than we have down here. So tell us a little bit about, do you deal with the single payer being the government, or do you have other insurance companies? Just tell us a little bit about how that's structured.
Yeah, so most all medical care is done through the government. Each province is regulated separately, almost like it's its own country. So each province negotiates with the physicians negotiate with the province and the government to come up with billing codes and our pay.
Huh?
So when I do a thing, I write a note, I tell the government, I just bill on the software that I did that thing and I did it for this condition, and then they pay me 2 weeks later. And then every few years, maybe every 6 to 8 years, they come and do an audit and they make sure that you're generally on target. So the billing system here is actually quite basic because they just want to know, did you see a patient or not? Did you see a patient for a long time or for a short time? Those kinds of things.
Okay.
So we have much less paperwork than our American counterparts. So we see many more patients in the day than our American counterparts because we have much more clinical facing time. So I would say when I talk to American family physicians, they may be seeing 15 to 20 patients a day. It was very common for us back then to see 30 to 50 patients a day. No, that
Wow.
was a lot. We were running around. We were definitely not going to the bathroom or sitting around with a coffee, but
Yeah.
there were high volumes. We were working hard and doing almost all patient-facing care. Now, there are some insurance companies, like for BC, we have the Insurance Corporation of British Columbia, that's for car accidents,
Okay.
or workers' comp, that's a private insurance as well. And a lot of us here have extended medical and dental coverage. So things like, you know, dentistry is not covered, eyeglasses aren't covered, hearing aids. So we may have forms we need to fill out for those insurance companies.
Okay. Okay. Interesting. Okay. So, you told us why you had a bigger clinic, obviously, because you wanted more flexibility and more work more as a team. But now that's grown to 20 clinics. So, again, why did that happen? Is that because you wanted to expand, or was that because the physicians that were with you said, well, I'd like my own office as well, and I'd like to be a part of you. So just tell us a little bit about how that grew.
Yeah, so when I was open 7 days a week doing in-person care, we being the only ones, we accidentally onboarded 50,000 patients.
Oh,
So I was one of those people to say, okay, one more person's knocking the door, I'll just see them. I'll just see them. I'll just see them. And there's a rule here that if you're in BC, you're a family doctor and you've seen a patient 3 times, If they don't have another family doctor, then you are their doctor. But everyone's doctor had retired. So I was somehow the doctor of tens of thousands of people.
Okay.
And I felt the need to do something about that. So I really started recruiting to help, to help with my problem. And
Yeah.
then started getting people, and then we started getting better at business at the same time. And then I guess with all the other clinics being closed or being far behind us in terms of technology and efficiency, more people were drawn to us and then they joined us. Then we ran out of space. Then I needed more space and so on and so on. It just accidentally bloomed to 20 clinics. And maybe
Wow.
it will be 30 clinics because right now there's no one else like us. Everything still remains quite mom and pop. It's a growing industry here. And doctors are just for the first time ever really learning how to work together and come together in larger groups. But it really wasn't in our medical culture to do that. So it's brand new for them and there's a lot of learning to be done.
So you said that during the pandemic, clinics were closing and so there were people available, but now is it, in the US, we talk a lot about healthcare provider shortage. There's just not enough physicians. There's not enough physical therapists in my field, and we're always looking for more people. Is that true in Canada too? Is it hard to find people?
Oh, yes, it's even more true here. So
Oh,
Canada was so restrictive. You could have done all your schooling here in Canada, then gone to Harvard Medical School. You would not be allowed to practice back in the country. It was very, very strict towards Canadians only. And when I was applying for medical school, it was very competitive and found a lot of people who didn't get into Canada would go to the US or the UK or Australia or the Caribbean for medical school.
mm,
And it was almost like they were exiled. They could almost never come home. It was very hard. There were some
mm,
pathways, but it was very hard. So when so many people retired in the pandemic, it led to a public uproar, and I think around 2022 in BC, they started allowing in a lot more foreign doctors, including Americans
mm.
and British, Australians. So now the gap is starting to be filled, but it's still a significant crisis. There are millions of people in this country without a family doctor in a
Yeah.
primary care based system, and I think 700,000 in this province alone.
Wow. So do you mind sharing with us too what the ownership structure is of your company? Is solely owned by yourself, or if I join your group as a physician, can I get some ownership as well? How does that work?
It's fully owned by me. I have
Okay.
completely bootstrapped myself.
Mhm.
No private equity, no funding, just me, my mortgage, my bank account, and and our business success. So
Yeah.
we've done quite.
Impressive.
Yeah, thank you. It was really hard. There were some days I thought I don't know how we're going to do this, but it really keeps you on track. Like if you don't have much money to spend, you certainly won't spend too much money. So you just become very efficient. You're disciplined.
Yeah, interesting. So now I'm sitting here thinking, okay, you're the sole owner, you're running this business with 20 clinics, and I read in the bio that you're still treating patients full time. How in the world does this work? I mean, did you hire a lot of great people, or are you just that good at multitasking?
I think I'm pretty good at multitasking, but I also have a really great team, and we've been growing. You know, um, Often the front desk secretary in a medical clinic, it's a dead end job, right? You get there and then there's nowhere to go.
Yeah,
Maybe, raises with time. So you end up with people who either can't move on from that position or people who do move on, leading to high turnover, very common. So in our um, group, I just tell everyone, you give yourself your own promotion. If you can do more, you show me how you can do more, and then we'll keep building and we'll keep growing. And we have a lot of really motivated people and people who want to make a difference, want to help the health system, want to help their own careers. And with that, I can say, we have this problem, who wants to fix it? Right. And then we get a bunch of takers with that.
yeah.
I'm actually on maternity leave right now. I have a 6-month old.
Oh, congratulations.
Thank you. So I'm doing the business, but I'm not seeing my patients right now. So I've actually ended up working the same amount, but expanding the business even faster. I think that's how we suddenly went to 20 clinics. I had a lot of free time, or free time, I'm putting air quotes here because I have a 6-month-old baby. But
Okay.
how do I do it? I think, when I see my patients and I see the gaps in care that have developed, I just feel so driven to just do something about it. I just need to fix it. And and then when I do the work to expand the business, to add more healthcare providers, to fix systems, I actually don't even count it as work time. It's like my
Yeah.
hobby. It's my hobby.
Yeah, that's great. So not that we have to compare everything, but it's just that what I know more. So in the U.S., I would well, you said before that in Canada it was a very mon pa type of setup, and it's changing a little bit. In the U.S., used to be private ownership of physician practices a lot. Then it's gone away from that a lot more, where physicians are joining bigger hospital systems and healthcare companies and things like that. So there's a little less of that. What's it like in Canada? Are you a very weird, or I shouldn't say weird. Are you a very rare breed of company like this, or are physicians in Canada starting to go more into the private sector, into private medicine?
I'm very rare, very rare. There's nothing like us, and we're still all in the public system. Of course, if my physicians want to do things like Botox or other private medicine, I support them and I help them build that practice. But I
Yeah.
always say that there's way too much bread and butter work to be done for me to engage in that.
Okay. So again, getting back to the leadership side here. So, I mean, I've been CEO of a healthcare company, and I know that this stuff just doesn't happen organically without, effort. So, what do you do to train those that work with you and other physicians in a leadership perspective? I mean, you've got to, I'm sure you want to provide the same quality care. You want to provide a culture that's nurturing and so on. So, how do you do that over 20 clinics?
That has been something that has been a topic of discussion with my management team for quite a while. So we've been trying to figure out what technologies can help, what onboarding materials we need. We're still working on it. But right now, what I do is I interview every healthcare provider myself, and I tell them the expectations for the clinic, which are mainly that we need to treat each other very, very well with kindness and respect and compassion, and everything else will come later. And I hold them to task on that because it's very important to me. And I just give them my phone number and say, ask me any question anytime. And then we have meetings with our managers and we train the managers for that knowledge to trickle down. And we keep the communication very, very open so that they can feel um, like less, I'm not gonna say no frustration because every job has its frustrations, but less frustrations because they can feel heard and they can feel like things are handled in a efficient and quick manner. So when it comes to healthcare, you know, I know that they've been trained well, that they have good character, but when I interview them, I let them know that this is what we are about. This is who we are. Do you like that? I want you to be happy and I want our team to be happy. Is this something that fits with you? And if they say it fits with them, then generally they move quite, well with the clinic culture and provide good patient care as long as we keep their frustrations down.
And I also know that you have very flexible work schedules. So well, you have to work here 40 or 50 hours a week, or you can't work here. You have very flexible. And so, um, do you think people respond to that, and do they take advantage of that, or is it possible to build a company with that much flexibility?
I think it's partly part of the payment structure. So with the physicians, they bill for what they do. So if they don't work, they don't get paid. So they have a natural incentive to work more. But
Okay.
just say they don't want to work at certain times or work more. No, I don't give them any metrics like that. I think that we are one of the very few people that don't give them metrics like that, and that is one of the big selling points and why people join us.
Yeah.
And I have found it generally does work out. I mean, I say it all comes out in the wash. Um, and we're able to pay our bills. And in the end, I can't motivate someone more than essentially the high housing cost prices of Vancouver. That
Yeah.
is really the biggest motivator to make them go to work and make more money.
So does each of the facilities, each of the clinics have kind of a clinic head or a clinic director or whatever you call it that kind of runs that clinic, or do you just run it as 20 sites under one umbrella?
Yes, I think of it as a single clinic, a single virtual clinic with
Okay.
multiple folds. And that's the best way in order to manage the staffing and to actually cover the patients because it's impossible nowadays to have a doctor be there 24/7, 365.
Mhm.
So if you only have three or four people covering each other, it's actually a lot of work when one person steps out. If you have 100, 200 people covering each other, it just flows right into the system and it doesn't feel like everyone gets overburdened and overworked when people are on vacation or people are sick.
So on the tech side, to be more efficient and so on, do you have an EMR or an EHR? How do you communicate with? It sounds like it's different in the sense that you do communicate with computers and technology with the government side of things, but do you communicate with the hospitals and that are taking care of patients that go beyond what you can give care to?
Yeah, so we have our own electronic medical system that, is shared between all of our clinics. And in British Columbia, we have a few things that help with us, help, connect with other other things like the hospital. So Care Connect allows us to see anything that's ever been done in a hospital, and
Okay.
that's an EMR. And we have PharmaNet, so we can see everything that was prescribed to someone in the past year, so you can make sure that you're not having drug interactions. People frequently will forget what medications they're on, and you can actually just look it up and make sure that people aren't, you know, double doctoring, as we say, for certain medications. You can look that up. So um, we don't have a government EMR per se, but we are able to access the hospital system, and we have our own clinic EMR.
Yeah, and would you say, from your knowledge, is that a little different than in the US? Because I know that, in the US, sometimes there's proprietary systems that, I can communicate with this one, but not that one. And so to get that universal connection that you just described, I don't know if that's necessarily guaranteed or normal in the US compared to Canada.
We don't have private hospitals here. Everything is a public system. So we have different health authorities, and they have to come together to decide to share their data and do things like that. But we don't have, I guess, the segmentation that the US has that
Mhm.
would prevent that data sharing.
Yeah, yeah, very interesting. Okay, so and what do you do then for, is it multidisciplinary or is it strictly family practice? Do you have other physicians that have specialties or do you refer out to those?
I'm starting to move into specialty care. So if as of last month in July, they started allowing several American specialties to practice as specialists in Canada because the systems are a little different. So the residency is shorter in the US than in Canada. So previously they weren't allowed to. But with our significant physician shortage, they have to make some changes. And there are people out there with 20 years experience with, a 2 year shorter residency, a 1 year shorter residency, not able to practice in Canada. So they've made those changes. And now I'm starting to bring in a lot of these Americans. Because as I said, in Canada, we don't train that many, and we didn't allow in that many foreigners. So there's not that many of us to go around. So the biggest pool of people coming in now are from other countries. And
Interesting. Yeah.
US being right next door, speaking the same language, there's a lot of you. There's a lot of you. So a lot of people wanting to come up now.
Yeah, that's interesting. So, when you look at this too, without asking you too much detail, but I'm just interested. You said you had an executive staff or administrative staff. So what does that look at like? Because again, with 20 clinics, that's a lot to take care of. So do you have a pretty big staff underneath you that does the business side of things, or are you still you're still kind of doing it mostly yourself?
For business expansion, I like to do it myself. My husband's also a family doctor, and I call him my CSO because I run a lot of ideas by him, and he has really good world context, so he gives me lots of great ideas. So he is very helpful with that. And when we do construction, he's also very good with that. The operation side, I've started to hand over in the past few years. We've expanded quickly because I feel like once systems are set up, I don't really want to be there in the trenches, managing this person had a fight with that person, or this machine broke, well, you have to buy a new one. So I've passed on the operations.
Okay.
Now I'm also starting to expand on the business side in terms of putting in proper policies and procedures. When I was there 7 days a week in person, I could
Right.
just say, this is our policy, right? But now when I'm not there, we have to standardize. So we're in the process of standardizing absolutely everything right now. And I have a number of people who are doing that day in, day out.
Yeah. And so you said you wanted to be more uh, forward thinking as far as on the tech side. So I assume that, like you said, you don't have paper and are you trying to do everything, as high tech as possible to improve that efficiency?
Yes, yeah. When I started my first AI scribe, which is, an ambient listening AI that listens and then writes the medical note for you,
Right.
I think it made my entire life 40% better. Not just my work life, like my entire life 40% better. It's
I
just
can
typing
imagine. Yeah.
every day is so sad. And we have a lot of different AI technology. So every time something becomes legal, we sort of add it to our system. And sometimes I'm very impatient. I see that something should exist and it doesn't yet exist. And I contact, some tech companies and some other people and try and make it happen. So my newest project that I'm trying to make happen is an AI receptionist. Because how often have you heard someone say, I just can't get through to my doctor? You know,
Yeah.
'Cause all
Yeah.
the phone calls occur as soon as the clinic opens, right? And then they just keep going all day and people call and call. So I'm thinking if we can just pick up all the phone calls, how much happier will everyone be, including the front desk staff who at some point I think they just get sensory overload with all the ringing phones.
Yeah. Yeah.
So I'm trying to bring people together to make that technologically happen. So I'm even implementing technologies that don't yet exist in the market in medicine.
Have you considered ever using a service overseas for that front office piece? I mean, there's a lot of a trend now, not a lot, but a trend now where, people are using, people from the Philippines or Latin America or somewhere to, you know, help with that burden. And most of these people, love working for an American or Canadian company and would love a job like that. So have you looked into that at all?
I did look into it and I was really so gung-ho about it until my new IT team told me, you're not allowed to do that. Patient data is not allowed to leave the country. And I thought, right, I forgot totally.
Uh,
So everything needs to be set in Canada. It also is very frustrating with technologies because sometimes you want to get this great technology, other companies are using it, but it's an Australian company or an American company, and the data has to cross country lines in order to use that service, and we're not allowed to use it.
oh, interesting. Yeah, yeah. Well, there's so many things to consider. So, I would think that, as you said earlier, you have less paperwork, and now if you're using AI, help as well, I would think that American physicians would be very interested in coming to work at your company because you talk to any physician or any healthcare worker, and their biggest pain in the butt and the thing they hate the worst is the paperwork. So
Yeah.
anything you can do to decrease that, I think, would be a good recruiting tool.
Oh yeah. When I talk to them, I tell them how little paperwork we do. I mean, I want to toot my own horn and say, yes, it's my company that we do less paperwork. Yes, we do less paperwork than our compatriots here, but all Canadian doctors do less paperwork than all American doctors. Because I think that you just have so many different insurance companies. It's not one system, right? So you have to have these obscure, opaque processes
Yeah,
to get paid for each clinic visit or to get a medication for your patient. And you have to fill out so many forms in order to bill something. You need to justify each billing to each different insurance company. And it just leads to a lot uh, of I would say, unnecessary paperwork.
yeah, yeah. And do you feel like I don't want to put you on the spot here with your colleagues, but there's talk before, and maybe this is just an American bias or view that used to be like sometimes Canadians would come south of the border to do some of their specialty work or some of their specialty surgeries and whatever because maybe they felt the care was better or more advanced and whatever. Do you feel that way, or do you think that has changed?
I don't think that Americans have more advanced healthcare, but if you in Canada, you could be a billionaire and you could be homeless and you would wait on the same wait list to get the thing done.
Okay.
And if you have the money to just pay to have it done, that's not legal in Canada either. Or it's now becoming. So where do people go when they say, I'm just going to pay to get this done? I'm not going to wait a year and a half to get my hip replaced. Where do they go? They just drive across the border and
Yep.
then they get it done. And because it's also a private healthcare system, you get your food on China plates, I'm sure, and people touch things too, and it smells really good, and I'm sure it feels really nice because it's a private medical system. And I can definitely see the appeal. So I think that in Canada, we've talked a long time about the evils of a two-tier health system. And the second, it's the meaning that richer people get better care and poorer people get worse care. But I think we've always had a two-tier health system. It's just that the US is one of those tiers for us. And that's
Yeah.
why so many of us go there.
Very interesting. So if I was to ask people in your organization and I would say, what kind of a leader is Julie? What would they tell me? What's your leadership style?
I think that my team thinks I'm a very kind person. I take everything they say into consideration and that I'm very flexible. I don't believe in hard rules. I think that changing situations require different solutions. So I encourage them to bring absolutely everything up to me.
So, how do you deal with the stress? I mean, okay, now you're seeing patients and you got to deal with their issues. You're running a 20 clinic organization without a lot of, layers, it sounds like.
Mhm.
You're a new mom. Um, how do you do it all?
I think it's just I think it's just practice because I've been doing it now for long enough. So when you start anything new, it's so stressful. Like I remember seeing my first patient without, after residency with no one watching over my shoulder. And it was terrifying. And then, when I first opened my clinic, it was terrifying. When I made my first hire, when I made my first fire, that was so scary and so horrible. I had nightmares for months about it. And now it's nothing. So I think it's taking those gradual steps, having self-compassion, and just to keep plugging away, knowing that it'll get better and just acquire one skill at a time, progressively, knowing that once it all becomes easy, you have more energy and time to get another skill. And just don't stop.
In preparing for this interview, I heard you say and somewhere else that, you like leading with empathy while maintaining operational discipline. So that seems like two opposites there. So how do you do that?
I think you just have to, it's like parenting, right? You have to explain why you're doing something. I'm very, very sorry that we can't give you a pay raise right now, even though you're working really hard, because, and you give a number of reasons, and you have to hear what they have to say, and then you say what you have to say, and then you have to place boundaries, right? And just say it's not working for that person, then you have to respect your own boundaries and say, okay, well, let's find a better situation for you, something like that. So you just have to let people feel heard. I think that's 50% of the battle, right? That they don't want to feel that you are not listening to their concerns and just disregarding their problems. That's not what they want. I think that once you do that, people will usually fall into a discipline line. But if that doesn't happen, you look up other possibilities about how you can make it work for them in a way that doesn't harm anybody else. And then if that option is exhausted, you sort of leave it in their hands and say, well, maybe this is not the right fit for you. And then they will decide if they will make it a good fit or if they will find another fit for themselves. And just don't hang on to something that's not working.
So do you have you had time, is probably the better way to ask the question, to think of what's the future of this of your company? Is it going to be, you went from 7 to 20 fairly quick. Are you going to be 40 pretty quick? Are you going to be 60? What's your strategic goal or growth goal, or do you have one?
I have a lot of loose ideas because I think you can only plan a few years into the future before the situation changes too much.
Hmm.
Bad thing about having a single payer system is that when that single payer decides to make a change, now you just have to live with it. You can't do something else. So I try and make our system as robust as possible in as many ways as I can, diversify, adding specialists, adding allied healthcare, doing those things. But I do believe that we probably will have 40, 50, 60 clinics. And then after that, I don't know what the future holds.
So again, in the US, if you had a company that grew like that, like yours has, and you have those kind of growth goals, you would have private equity companies and other companies probably ringing your phone all the time. So is that true in Canada as well with the single payer system, or is that less an option for businesses looking to invest?
I have had private equity reach out to me, and it's something I had never considered because, at the time I started my practice, I used to say, I just burn this place to the ground when I go. There's no value in a practice, right? But I think when you have 20 clinics, it does have value, and people have started to talk to me about it. But I don't know how I feel about it as of yet because I've never really seen private equity in the medical system in Canada. I have seen in dentistry and veterinary care, which,
Okay.
comparables.
Yeah, yeah.
I'm always willing to talk to people and see how things can grow. I don't know if I can bootstrap forever. For example, if I get a big idea, maybe I'll need to talk to private equity. But for now, I think I'm very happy with how things are going, just self-funded and growing the way we are.
Now, your colleagues, I'm sure, are noticing, and so are they saying, "Wow, maybe we should do this"? Is there a trend to do more multiple clinic sites like this?
I think so. I've started to see a few companies or groups do that,
Yeah.
and I'm always happy to, talk to them and give them advice because in the end, there's just a lot of work to be done. The main goal would be that everyone has amazing healthcare in Canada all the time with easy access. That would be the main goal. So if we can achieve that, then I will be very, very happy. And I think growing my business is a secondary goal. So I'm happy to help anybody, but there are still not that many of us. And I think it's just very hard.
When you get up in the morning, what gets you going? What gets your fires going? What do you look forward to?
Oh, I just look forward every day to my babies and to my morning coffee and to doing something fun. I just like to do something new and interesting every day. I can't do the same thing repeatedly. It's not in my nature.
Is this your second child that you just had?
Yes, yeah. My other one is almost 3.
Oh, wow. Okay. Well, you got a lot going on. Busy, busy, busy. So, when you look out, and I know it's hard to predict, healthcare, is ever changing and trying to make it work financially and all that kind of stuff. What are you most concerned about? What do you think is going to be most challenging as you go forward?
I see that there's a lot of great ideas, particularly everyone talks about AI. Is AI going to take over, right? I don't think AI will necessarily take over. But I think some of the challenges are this drive that I have and other people have to add new technologies, but also have it still be safe for patients and also data compliant, which is a thing I had never ever thought about, but is a huge issue. And I think the bigger you get, the more likely you are to get phishing emails, to get hacked, to have that patient information stolen. And I think that these are going to be big challenges in the Canadian system because we don't have these mature companies with giant IT teams like you have in the US or other countries. It's just a mom and pop system trying to do something um, now with a sudden amount of complications, technology, rules that they're going to be unable to manage. So I think in Canada, that's going to be a big thing. In terms of health, I mean, we see the rising obesity issues, right? We see patient expectation changes. People rightfully want to feel perfect all the time, but sometimes it's not possible. Maybe our medical system isn't able to. So you see a lot of proliferation of things like, oh, if you just took this supplement, if people advertising health cures to patients that are not evidence based, I see a lot more of that, in the age of Instagram and TikTok. And that's very hard to handle as a provider who wants to be there for their patient, but also wants to discourage them from doing things that are not evidence based. And of course, you know, the pandemic, you see lots of black swan events happen. And is your system robust enough to handle that? That's, I think, a big question for the future.
What about mental health? Is that as big a concern as Canada as it is in the US right now? Is that something that seems to be increasing and people need more and more help with?
I think so. I think one of them is patient expectations that they don't want to live bad lives crippled with mental illness and just, we've all met some older person who's been chronically depressed or chronically anxious and thinks they're fine, right? The younger generation doesn't want to be like that.
Right.
But I think with social media, different expectations, the state of the world, climate change, wars, I think the newer generations are starting to feel quite down about their futures. Housing prices, the decline in quality of life for some people. I think there's no easy answer to that. You can't medicate that away. And I don't really know what the long-term solution is going to be, but I think investing more in people's mental health is going to be one arm of those solutions.
So if I'm one of your patients, and why do I choose you over other people in the community? What's your differential advantage from a patient's perspective, do you think?
Well, there's more of us, so you can get more care. If you have one solo physician, they may or may not be able to see you in a timely manner. So with our cross coverage system and our growth of clinics, you're able to do that. We also have more technology. So instead of physically having to come and pick up your results from the clinic, we can email you password protected from the chart. We can work hybrid. We can fax things. We can follow up with things much faster than other clinics. And I think because our physicians are not given onerous things to do that they don't want to do, I think our physicians are generally happier. And I do believe there's a big benefit to seeing a physician that's happy as opposed to one that's burnt out.
Yeah, isn't that true? Yeah, so true. Well, in anticipation of our discussion today, is there anything that I haven't asked or I haven't covered that you want to be sure and get in the program?
I'm just very pleased to, to chat with you and talk about our system. I'm just hoping that more people can hear this kind of thing and know that you don't have to be a big corporation or big business to build something that you believe in.
Yeah.
And I was able to do it, and not like on my own without my family and my husband for sure, with
Right.
them and my team,
Right.
but I was able to do it on my own without big investors or private equity. There's a lot that can be done within your own passions, and I want people to know that.
Well, and we heard a lot today about, what you're doing, maybe unique and differently and more progressive. On the other hand, you must be doing something right. I mean, you don't grow that fast if you're just kind of muddling along. So, your system and your approach must be not only resonating with practitioners, but also patients, because it just seems the growth is impressive.
Yeah, thank you. I hope so. And I think that the key is to be keeping your ear on the ground and be very agile. Just keep changing things over and over and over again and just keep getting better.
Yeah. So, Julie, at this point in the interview, or I always ask my guests the same common question. That question is, in relation to leadership, what is a pearl of wisdom that you could leave us with today?
I think with leadership, leading is hearing the people around you. I think to lead, you need great ideas, you need to work hard, but you also need to be a great communicator. And without communication, you won't be able to lead.
So, with that in mind, is that just something that you have a knack for as a good communicator, or did you spend some time and effort in learning that and studying that and becoming better at communication?
All of those things.
Uh,
So I think I do have a knack for communication, but in medical school, they give you communication skills courses. And then over my career, I've talked to tens of thousands of patients, all with different personalities, trying to convince them of this or that, do this test, don't do that test, take this medication, don't take that medication. And over the years, you learn to read people much better and know when a person feels heard. And I think if you can do that, then you can communicate with anyone.
And do you do anything for your staff as far as leadership development training or anything like that, or have you considered doing that?
I often will encourage them to look for courses and then to train them in that. And then during our team meetings, I ask people to teach other people about lessons learned, and I make often presentations to show them about things that I think that would be helpful for them. As for formal leadership training, I think we have done a lot in-house, but not a lot out of house. And I think you're right. I should probably, find some more resources for them to learn more.
Yeah, just another thing to put on your plate, right? Well, Julie, this has been a pleasure. It's great talking with you, and as I said many times already, I'm impressed with your success and your growth, and that's awesome. So, congratulations on providing to your community and providing to the patients in that community a service that is definitely needed and something that people are looking for. So, I wish you the best of luck going forward with your continued growth, and congratulations on where you've gotten so far.
Thank you so much, Steve. It was great talking to you. Thank you for having me.
Okay, take care, and maybe we'll run into each other down the road one of these days.
I hope so.
Okay, bye bye. Thank you for listening to another episode of Profiles in Leadership. To listen to all my interviews, subscribe to Profiles in Leadership with Steve Anderson on Apple Podcasts, iTunes, and many other popular podcast platforms. Some of these interviews are on video, and you can search YouTube for Profiles in Leadership with Steve Anderson. You can also access the entire library of interviews on my website, orange.coaching.com, and that is orangetheword.coaching.com, and go to the Media Center and click on Podcasts or Video Gallery. You can also enter the website from pilpodcast.com.